Hello and welcome to the Workforce Wisdom Podcast. I'm your host, Christy Bray, Chief Strategy Officer at PracticeLink. This podcast focuses on the latest trends in healthcare recruitment while showcasing innovative strategies, success stories, and fresh perspectives affecting the healthcare workforce. These episodes will lead to an in-depth, thoughtful discussions with recognized industry-leading healthcare professionals and vendor partners exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode, Industry Insights, Recruitment Excellence in Healthcare with Jeff Ellman and Michael Krasman, features two individuals that co-founded a company called UrbanBound. Michael Krasman is the co-founder and CEO of UrbanBound, and the co-founder and board of director of Hireology, two venture-backed HR software companies based in Chicago. Michael has spent the better part of his 20-year entrepreneurial career helping companies solve their human capital management challenges via technology and is a noted thought leader in the space. Jeff Ellman, co-founder and chief strategy officer of UrbanBound, has dedicated his 20-year career to helping people through life's transitions. The businesses he co-founded included Humital, a recruiting and consulting firm, Home Scout, a residential real estate company sold to Coldwell Banker in 2016, and Hireology, a technology platform that helps companies make better hiring decisions, which was recently ranked 94th on the Inc. 500 list of America's fastest growing companies. Hi, guys.
Hello.
Thanks for joining me today.
Thanks for having us.
So we'll kick things off just getting to know you a little bit. Share a little bit about your backgrounds and what really inspired you to create UrbanBound.
Well, I think I'll start off by saying I feel like we're a married couple. We've been together for 25 years. As you just mentioned in our bios that we've started 5 different companies together. Kind of going back to the very beginning, our background was in HR consulting and recruiting. In 1999, I started a college recruiting company that helped small to medium-sized companies that didn't have large internal HR departments find top talent on college campuses. So my goal was to expand the business and interview as many students as possible, take the top 10% of talent, and then place them in jobs throughout the country. I needed help scaling that company. And at the time, Michael had started a very successful college business on, how many campuses were you on?
About 165.
165 college campuses. I was on one. So I hired him as a consultant to help me scale my company.
Yeah.
Let you take it from there.
Yeah, so my background has been as an entrepreneur my whole career. As Jeff mentioned, my first company was also venture-backed in the late 90s when it was called a .com. That has now changed in terms of how you talk about cloud-based software companies, but we had scaled it up to be across the nation and at some point had over 6,000 individuals working for us. So when I got introduced to Jeff, he was looking to scale onto multiple college campuses, and I had some experience in that arena, so we started working together and been working together ever since. So it's been a good partnership along the way here.
And that company led to other businesses. And I think that's pretty common with a lot of entrepreneurs is you solve one problem and you see other problems you can also solve. The other problems that we found were that when people were graduating from college, oftentimes they wanted to move to Chicago. We were in the Midwest, and we realized, well, we can support them with more than just helping them find a job. Let's help them find a place to live. Let's help them meet new people, get involved in charities and networking and was building their network. And we started an event planning company, we started a real estate brokerage, and that led to more businesses down the road with Hireology.
Yeah, so ultimately those 3 companies, we saw a couple of challenges that businesses across the board seemed to have. One was that you had a lot of individuals that were kind of thrust into a role as a manager and needed to hire all of a sudden and manage people, and they oftentimes didn't really go through great training on how to really evaluate talent and figure out who they should hire. And so we were doing that for our clients often by putting together interview guides and teaching them how to actually ask the right questions and look for the right behaviors to determine if someone was going to be a good fit. Ultimately, during the great financial crisis, we realized that product that we were giving away for free was actually really valuable. And so we decided to start a software company, which is now called Hireology. The original core of that product was helping to evaluate talent and find that talent and choose the right people to bring into your organization. And it's grown a lot since then. Now it's a full HRIS system for smaller and medium-sized companies. So we continue to run that business today as board directors, not as active managers in that business anymore.
And all these companies led to why we're on your podcast today, which is UrbanBound. We saw when we were in HR consulting and recruiting this very dangerous trend that was taking place where we would go talk to our clients and we'd learn about how they're supporting individuals that they had to hire that were not local. So therefore, they were relocating for the job. And when we asked, how are you supporting these individuals and their families that had to move for that job, we got the same consistent answer from almost like 95% of our clients, which was, we don't do a whole lot. We give them money, whether it's a lump sum in their first paycheck, and we ask them to front the expenses and figure it out on their own, or we're willing to reimburse them. They can collect all the receipts and submit those to us, and we have some policy that we can manage those receipts against. And we were just amazed at all the hard work that goes into recruiting talent and then the ball being dropped at the exact same point in the hiring process. So our goal was to build software that gave everybody a proven process to follow when they're relocating, but also to create more operational efficiencies for the organizations and find ways to contain costs by treating relocation more as a benefit, less as just the compensation of the lump sum or reimbursement.
Yeah, and I appreciate you going into that because that's one of the things I've always just not understood, because you really looked at that relocation package or part of their compensation and their incentive package instead of as a benefit, much like you would healthcare, medical insurance, student loan, those types of things where those become a benefit and shift into maybe some more HR oversight or benefit management oversight versus just that line item of lump sum cash that you've given to that physician. I think you mentioned earlier that greater than 50% of physicians are relocating. They have to relocate for their job. Given that, and like you said, the amount of time it takes to recruit someone, and then the expense if you don't recruit them on lost revenue, what are some of the innovative strategies that you've seen, maybe some of your clients or that have come out of healthcare within the last 5 or 10 years that have tried to push some of this towards more of that being a benefit versus here's just some cash and you figure out how to get here?
I'll jump in real fast.
Yeah,
we're seeing a reliance on technology and on AI. So specifically on the technology side, healthcare organizations are realizing that because so many physicians are relocating for the job, how do we improve at the very early on in the process that on-site visit and give them access to software that they can quickly log in and they can learn about, okay, these are the best schools for my children. These are the right communities. These are where my coworkers currently live if they're looking for an apartment, if they're looking to buy. This is where my office is. Here's how I commute to work every day. So leveraging software that gives someone an idea of what it would be like to actually physically relocate themselves and their families to that area before they even step foot on the campus is something that we're seeing a lot of right now. In addition to that, the analytics tied to on-site visits. So wouldn't it be great to know that this physician that worked so hard to recruit came into the platform and we can see that he or she is actually looking at schools and looking at neighborhoods versus just submitting receipts for their Ubers or their meals. This is someone who's actually engaged in learning about their community. That's a green flag. This is someone who's very likely to accept an offer or advance deep in the interviewing process.
Yeah. When you're relocating for a job, you're actually experiencing two of the most stressful life events at the same time. You're starting a new job, you're meeting new people, and you're having to uproot your whole life and move for that role. So I think a lot of companies, kind of back to your original point, Christy, they've supported them financially with the idea of them having to move, but they're not actually solving the real stressful problem, which is all of the logistics, all the uncertainty, all the planning that goes into having a successful move from point A to point B. And they're ignoring, in many ways, a major influencer in terms of that decision to actually take the job and move forward, which is the family. The spouse or partner in tow and the kids and the schools and all those decisions that we all think about when we're having to move. There's really little being done to support them when all you're doing is treating it, like you said earlier, as compensation versus as a benefit.
Candidate experience is a huge differentiator that too many organizations are overlooking. When you actually ask questions that are second or third level questions, like walk me through why you believe you have a great candidate experience, most organizations struggle there. They say, oh, we're really good at, we have a realtor we can introduce them to and they can do tours, or we've got the local chamber of commerce, we get this information on a Microsoft Word document. It's so outdated and it just needs to be improved.
Yeah.
And would you say, at least with the residents and fellows that we interact with, I wouldn't say they're looking for the highest level of touch, 5-star. They do want some interaction. They preferably want it through a technology. They don't want a Word document. They want to look at those pieces about the community that you mentioned on their own time. So I think that that's a shift where we being more proactive in building those pieces about your community and being able to sell the community and what's offered there to the candidate, and that you can track through data analytics on the platform how engaged that candidate is.
Our philosophy has always been incredible software that is available 24 hours a day, 7 days a week, so people, like you said, can do it on their own time because, again, we're dealing with people that are very, very busy, and oftentimes their only opportunity to do something might be at 11 o'clock at night. But back it up with incredible support so that when they have those questions that they just want someone's expert advice on, someone who's been down this road many, many times and can provide that insight. And that's how we've built our solution. And I think anybody trying to solve these problems has to realize that it needs to be a combination. Because if you go too far in either direction, it's either way inefficient. If you're only trying to talk to people and you can only do it during normal business hours, that's obviously a way you're kind of restricting it. But also, if it's only software, you may be missing some of the context.
We've seen a lot of, it doesn't necessarily apply to physician roles, but a lot of the remote and hybrid work models. Obviously, I'm working from home. I know you guys split your time between locations, but what have you seen in kind of the evolution of relocation assistance specific to healthcare professionals? I know, executives and maybe director level positions in a hospital often got a relocation package, but it's not as common now, I think, as people are starting to stay and work where they live. But what have you seen kind of evolve over the past few years, given those changing in work models?
So UrbanBound, we work heavily in healthcare, but we also do have customers outside of healthcare. And during the pandemic, for example, we saw a lot of industries, particularly technology, where there was this rapid shift towards working remotely, mostly because it was an option. If you're an engineer, you're in marketing, you're in sales, you can do a lot of your work as long as you have a good internet connection and a laptop or a desktop, I suppose. You can do it kind of from anywhere. And yet, when we looked at our customers in healthcare, we didn't see it as aggressively shift towards a work from home because, again, the need to see a patient in person isn't going to really change that much through tech. What's happened more recently, though, interestingly enough, all those industries where you saw the pendulum shift towards like remote work, we are seeing a rapid rebound back to in-office. And I think it's because a lot of companies found that they're losing out on some of the serendipity that happens when people are working literally in the same location together. The banter that happens, we always, for years and years, Jeff and I have always said, culture is caught, not taught. And I think that's so true. And I think a lot of companies recognize that despite the ability to do the work, maybe you're losing out on all the other intangibles around company culture, around learning, training. I think some of the folks that really get disadvantaged in a work remote environment is the newest employees, the people that just joined the organization or people that are earlier in their career. I think of all the learning I had just overhearing somebody in the office having a phone call with a customer, or you're sort of like you're taking away certain lessons on how we explain certain parts about our business or whatever that it's really hard to do when you're only communicating through Slack or Microsoft Teams or whatever it might be. And again, in healthcare, there was maybe a little bit of a shift towards remote, but we are seeing a lot of that come back. So for the most part, I don't think the need for relocation, has really in the end been impacted at this point.
And I think if anything, you see just a lot of hybrid models coming out where good companies are trying to respect that boundary of it is helpful if that person can work from home a day or two a week so that they could more easily get to a child's event, or on their lunch break, they do a load of laundry. And a lot of that workload has fallen to women. And so I think you see, what I hope is companies continue to do that, so it evens out a little bit on that stress that you mentioned.
I think you're exactly right. Yeah, the flexible model is, I think, here to stay for sure.
I think that's a good thing. I don't know how they do it in other countries, but I think it's a good thing here. When healthcare organizations align with UrbanBound to provide support to the new hires during their transitions, what are some of the keys that you've found over the years that are really important that people that aren't using a platform or they give them a paper packet, what are they missing out on that a platform like yours helps uncover for that candidate?
The number one thing is about the experience. So when you have a proven process that everyone can follow, you can guarantee that the high majority of the time is going to be consistently a great experience and great first impression of the employer brand. There's just way too much risk in relocation without software to manage the logistics of moving. For example, if I go on the internet and I try to find the right moving company or the right short-term housing complex or the right auto shipper, I don't know who I'm going to get. I don't know if I'm going to get the best possible price, the best service level. And with software, especially that has reporting tied to it, it can show you, it can de-risk every single move and say, these are the best suppliers based on origin and destination of the move. Here's the best possible price you should expect. And as programs grow, become more intelligent based on the volumes that are coming through, ultimately you get better pricing too because of the sheer volume. Like for example, we're moving tens of thousands of people a year. You can imagine one healthcare system that's going to move a few hundred, who's going to have the better pricing, our network or their own network they're trying to build. So that's one of the key things.
And I'll add in, you also get a huge boost in the quality because every relationship that we have built with each of these suppliers, A, it's been vetted up front, but B, there's a real focus on making sure that every single time they're delivering 110% because they don't want to jeopardize the bigger relationship over one individual relocation. And as an individual consumer, when you go to a moving company, unfortunately, one of the number one, if not the number one most complained about industry is the moving industry on the Better Business Bureau and on those websites. Why? Because people have major problems. Things get broken and they're not reimbursed for it. Or the worst is you're given a quote and then the goods show up and you're not going to get your goods unless you pay the marked up price because the weight was underrepresented when you were given your original estimate. And that's a very common tactic, unfortunately, used that never happens when you work through a company like UrbanBound because we have a service level agreement with every vendor where they can't do that.
We've talked to a lot of clients who have retention challenges over the years, and it's interesting. Retention goes all the way back to the relocation and onboarding. If the physician has a soft landing in his or her new community, and they live in the right community, their kids go to the right school, they've met the right individuals, whatever it might be, and they love their job, they're going to stay. If I were to say, okay, they love their job, but their family's not happy and their kids are in the wrong school, they don't live in the right neighborhood, there's a very high risk of them leaving. And that just goes back to because you just gave them money and you hope they made the right decisions and had the right resources. And too oftentimes, they're making rapid buying decisions in a few weeks, and they make a lot of bad decisions because they don't have the information in front of them. So great relocation software lays it all out for you and says, if you just follow these steps, you should have a smooth transition and you should be retained.
And the best part about it is we will often save our clients significant amounts of money as well because the approach that's being taken today is a very blunt object. It's like we're going to give everyone X number of dollars, and how did they choose that number? Usually it's because that was the dollar amount that magically made most of the people complaining about how much they were given go away. And so it's just sort of this arbitrary amount where instead of using a hammer, a platform like UrbanBound, we're using a scalpel. We're figuring out exactly what an individual needs for their situation and giving them the flexibility to find the right suppliers to match their needs. And lo and behold, our healthcare clients save a lot of money as a result. So it's a win-win for everybody.
Hey, Christy, we ran a benchmark on this. It was fascinating. So 94% of relocations that stop treating it as a lump sum, so let's just give an example, $15,000, and you move it into relocation software and you give the physician up to $15,000 to spend, 94% of the time they will come in underneath that relocation budget. And that difference there is cost savings to these healthcare organizations that are all looking for ways to contain costs of average of like $2,000 or $3,000 per move. So if you're relocating a few hundred people, it's hundreds of thousands of dollars in easy savings, low-hanging fruit.
Yeah, absolutely. You know, when you're working with primarily the physician recruitment team, but bleeding over into potentially executive relocations or other things, have you had clients take full advantage where all of their relocations come through UrbanBound? So you've expanded more because if you're recruiting a new CEO to a hospital in Kansas, you know, it's the same information you would want the physician to have. These are highly compensated individuals. They provide a lot of value to the community. So have you found that when it's truly integrated throughout exec recruitment, you know, kind of the whole talent acquisition team, including physicians, have you had some clients that do that with probably even more profound success, I would guess?
Almost every client.
Yeah.
That's when they partner with us, they're thinking across the entire system, not just like one population.
Yeah, the trend we've been seeing is a lot of healthcare systems previously, maybe call it for the last, decades, have been very decentralized in their decision making, and increasingly they're looking to find ways to become much more operationally efficient across the entire organization. And so they're trying to centralize some of these decisions that may historically have been made 12 different times in all these different groups, and they're realizing Group A and Group B and Group C are doing it completely differently. There's no consistency. Frankly, it makes it very difficult for them to manage their brand and how they want to be perceived by anybody that they're recruiting, whether it's an executive, a physician, a nurse, clinical staff, whatever. And so, yeah, I think what you said is absolutely the trend going forward. We're seeing it more and more where they're trying to find the best-in-class solution and making that the standard for
the center of excellence.
Yeah, the center of excellence, yeah.
So have you guys found that as you're trying to help recruiters, which is the focus of this podcast, if a recruiter's like, oh, this sounds really interesting, I do think it would help. We've got these communities that we serve. Maybe it's one community, maybe it's 90 communities they serve, and the scalability of the technology. But I would want to talk about, are your key stakeholders that recruiter needs to bring an idea like UrbanBound up to? Is it HR within that benefits section? Is it within the physician, the medical group, or is it within supply chain? Because you do see some companies, because it isn't a free expense. It's not one of the highest things you pay in a hospital. But over time, relocation can add up. So where would you tell a recruiter that was looking for a solution like UrbanBound, what would be the next steps they would take?
So typically it's going to be the chief medical officer wants to see there's a joyful experience for the physicians that are working so hard to recruit. It's a CHRO. It's the director of talent acquisition. It's really all across the board. I can't say there's like one key stakeholder, but usually when it gets to the C-suite and they look at this and say, wow, okay, wait a minute, we can save $2,000 or $3,000 per move, and we can improve the experience, and we can create operational efficiencies internally. This is a no-brainer. So if it gets in their hands, it's very rare that they don't want to make a change. And when they see all their competitors are using this, so we just need to get usually our message in front of them, and the recruiters, as they work their way up the organization, there's a lot of excitement around the idea of change and not treating relocation as comp and really thinking about this as a benefit.
And I know we touched on this a little bit earlier with, really for me, that retention starts with that very first interaction with the health system. So in the past, my teams, it was usually my sourcing specialist. So they were the first email, the first phone call. And so from that very first touch, you wanted to make sure all the way through their first day in their clinic, the 90th day in their clinic, that things were at that exceptional level. Like you mentioned, are there pieces within UrbanBound that can really help those hiring teams and the recruiters really create that seamless onboarding experience? So you're taking the candidate through, hopefully, red carpet experience, site visit, then you plug in, and then you go all the way through onboarding. Tell me a little bit about how you could help folks collaborate, or how the technology helps those teams collaborate together.
So I think it's a couple different things. First of all, as Jeff mentioned earlier, we have incredible reporting. So again, this is a completely new world for an organization that doesn't currently use anything like an UrbanBound, and they're just giving money. Not only, as we mentioned, all the other problems with that approach, but also you have no clue with what's actually going on. So even the ability to jump in and lend a helping hand or realize that something is maybe going a little bit sideways, you wouldn't know that when you just give them money, because all that decision making is happening in a void. And so with UrbanBound, first of all, just being able to see what's happening, and then again, as a recruiter, you can sort of realize, oh, this individual really needs to book this already. I'm going to jump in and I want to just talk to them and see how things are going. So it gives you an extra lever to be able to understand what's happening. Furthermore, we have this concept around a timeline. So all the different events that are going to happen from the time that you're really early on doing your on-site visits all the way through when you're actually planning your move, and then your first few days on the job and getting set up and starting the credentialing process, etc. It's a very flexible concept where teams can actually put the unique activities or milestones or events that they want to have happen. They can actually design our platform the way that it works for their organization. So we've made it a very flexible system intentionally because we know every company's different, every healthcare system's different. Some of the activities they would want someone to do in advance of starting will be different. Maybe you want everyone to watch a welcome video from the CEO, and all of that can be embedded in UrbanBound. And going back to what Jeff mentioned earlier, the key here is consistency, because in the past, you may have been doing some of these things, but you're relying on dozens of recruiters to remember to do every single activity every single time. And with a platform like UrbanBound, it can be programmed once, and then we will drive that workflow every single time. And you can see that things are actually happening and they're being checked off the list.
To give you an example, I'm starting January 20th, my new job, and on January 19th, I get an email, and it's a welcome video from the CEO. That's a wow moment. My employer is excited to see me tomorrow, and I can't wait to get to work, versus showing up and really not knowing who's going to meet you at the front desk.
Not knowing which door to go in and those types of things. Yeah, absolutely. And I think that goes back even to site visits, like really well done site visits. Take the time, make a welcome sign, especially if you're in a small community, single hospital type. You can make a little welcome sign, let the staff know this candidate is interviewing, we're bringing them around today. It's amazing what that does for the person that is interviewing that day.
Celebrate them, yeah.
Absolutely, absolutely. Because it takes a lot to get that right physician. You've spent a lot of time recruiting them to have them come in. So it should be a big day, and it should be a position where you're able to wow them. Do you have any other clients where you've integrated potentially with their applicant tracking system, or maybe it's with their credentialing software? Because that's a lot of our onboarding ends up those credentialing timelines and those dreadful packets. Maybe even with an HRIS software where from that talent acquisition, they have to do their TB testing and stuff. Are you able to integrate with those? Not that you need all those milestones in UrbanBound, but so that candidate experience, it's kind of living in a space. People aren't missing checking the boxes, if that makes sense.
Yeah, absolutely. So I'll say a couple things. So we've designed our system to have an API that is able to be communicating with other systems upstream and downstream, depending on which direction we're talking about here, if it's on the recruiting side or if it's after someone's been hired and now they have to be fed into other platforms. So we have the ability to make it very easy for data to flow. That was kind of the major problem that we're trying to solve here. So you're not having to do as much duplicate data entry into multiple places. Going back to the way we built our experience to be very flexible, we make it easy for healthcare systems to put instructions into our software to direct people to where they need to go. Because oftentimes, to your point, we are actually continuing to investigate actually on our product roadmap ways that we can embed more direct connectivity to how, let's say you're doing credentialing. The reality is what we have seen so far is that everyone does it differently, very differently. And so ultimately, you want to design something that is very ubiquitous and seamless for all of our clients. And that's an example of a place where a lot of companies do it very, very differently. A lot of healthcare systems do it very, very differently. So we're looking for ways to make it very easy to provide the instructions of what to do, direct people to where they need to go, and take that risk of a person or a human at the healthcare system remembering to give you the instructions at the right time. Take that risk off the table, because our software won't ever forget to deliver the 24-hour in advance email that Jeff mentioned a moment ago, because it's locked and loaded. And we already have the ability, to your point, about moving someone from like the applicant tracking system directly into UrbanBound, so that, again, you don't have to double entry that information. That's already built into our platform, so very easy to do.
Yeah, and I think even if you weren't connected through an API or had the data flow, even through an onboarding checklist, and you've got maybe some key credentialing milestones built in there, your technology, maybe it reroutes them back to Cactus or whatever the tool is that health system is using for that. So you don't have to embed them together, tie them together, but you could create some of that within that client's portfolio.
And knowing that we can drive somebody to take care of that activity and keep track that it's being taken care of. So that's the key. It's just managing that workflow and getting it out of somebody specifically having to remember to do all of that. And oftentimes it falls on the recruiter, honestly. We see recruiters picking up some of that slack.
So it really expands, for me, UrbanBound is much more than just assisting with relocation. It really backs it all the way up to onboarding, which is one of the biggest pain points I think, in any industry, bringing new employees on in a meaningful way that you retain them?
That was like probably the number one piece of feedback we heard from our clients in healthcare over the years. And this goes back 4 or 5 years ago. Our healthcare clients were saying, okay, you guys are doing a great job relocating our talent. We need you earlier in that hiring process to influence someone to actually take the job so we can relocate them through UrbanBound. Can you turn your relocation packages into travel packages and assist with the on-site visits and assist with onboarding and assist with all these different workflows that we have right now that are not well run, disjointed, very manual, et cetera. And that's exactly what we've built and we continue to build based on the feedback of the market.
Hope you're enjoying today's podcast. Just wanted to break in here to remind you of PracticeLink's new Physician Resource Center at PracticeLink.com. PracticeLink's Physician Resource Center is a collected hub of content which includes valuable resources and information about contracts and compensation, the job search and interview process, quality of life and wellness, and many, many more areas designed specifically to inform and support physicians' professional growth and success. To check out our Physicians Resource Center, head over to PracticeLink.com today. Thank you for listening, and now we'll return to the podcast.
I'm going to shift a little bit and talk about our underserved and our rural markets and where you guys might be able to help. In your opinion, what role do some of those community partnerships play that I think in a small or an underserved area are even more important to attract and retain those healthcare talent folks? How do you do that, and what role do you see those partnerships playing at the local level?
So in those underserved markets, a lot of times what we'll do when we meet with a new client who is in a rural area, for example, we'll work with them. So what are the most commonly asked questions that physicians have when they move to this location? What do you want them to know up front? And let's put all those questions and answers directly into the platform so we can get ahead of any concerns they have. Let's give them the opportunity to actually identify what are they looking for in the ideal neighborhood, and then match those local neighborhoods up in the software to, okay, great. This community is perfect for me because I said I want to be in an area where people come from this background, they speak this language, the school ratings are above X, and it can do that for you too. Also, being able to tie in if they do have relationships with the local chamber of commerce, rather than having to remember to send an email and attach a document or send a link, that should all be housed directly in one centralized place. So anything that helps sell the community is there within the UrbanBound relocation platform. So nothing's ever forgotten. It's like you put in there one time and it's just everyone's going to have access to the exact same information. One final piece we find in these rural areas is something that's called coworker insights, but it's really anonymized people analytics that shows you amongst my coworkers that already live in this rural community, where do they live? Where do their kids go to daycare? What's the most popular gym? Where do people, if they're renting, what apartment do they rent? What's your favorite restaurants in town? Putting that all into the platform is great for the candidate when they're coming on site because they can experience those restaurants and coffee shops. And if they take the job and they relocate, they know exactly what to do without having to go ask all their coworkers because the data is all there. And once again, it's anonymized so across hopefully hundreds of people who've already been in their shoes before.
Yeah, if I'm a recruiter listening to it, it sounds great, like really good information. It all lives in a platform, but I'm also thinking, do I have to write all of that? Do I have to involve my marketing team? How does UrbanBound build the profile of the community, the hospital? How do you do that to provide that support so the recruiter is not trying to find all the maps and the places to send folks?
We have a very organized onboarding experience for our clients at the beginning when we first start working together. And to Jeff's point earlier, what are those frequently asked questions? We actually have a very point-to-point process of getting all that information and sussing it out of the organization because it usually lives somewhere. It just may not be central how it's going to be once UrbanBound's turned on. And so we're pulling that sometimes from the website. Sometimes it's from, kind of to your question a little bit more, local real estate companies that you've been working with successfully. We'll bring them into the platform. They love to work with UrbanBound because we will make sure that we're consistently getting the people in front of them at the right time in the process. Because oftentimes people might go off on their own and start trying to figure things out without having a local guide to help them with that. And we make sure it happens early on in the process and it's consistent each time with the ones that they know deliver the best experience, frankly. And oftentimes they'll have great guides and we can take that information once we're working together to deliver that also to the candidate.
Let's give an example. One of our clients out in Memphis, they were having trouble getting people to move to Memphis. So they actually started having some of their employees create videos of themselves in their front of their house saying why they love living there. But they didn't really know how to get that into people's hands. So as soon as they had the content, we saw like, this is unbelievable. This should be in your relocation platform. This all should be in your onsite visit platform so that people can get a feel for what it's like through the eyes and ears of their future coworkers. And that was really powerful that they just took the time to do that. I thought it was really important, but that's probably great best practice for other systems to do as well.
Yeah, we do see videos on our site perform really, really well. And I think just the folks are now just used to watching that or Googling it or YouTubing it and finding out a way to learn about something.
And I'll also mention, we look at our partnership with our clients as a long-term evolving relationship. We started in one place, and then over time, as we learn what's working and what can be improved upon, we're always making changes. Kind of going back to what you were asking, which is like, if they're hearing this and thinking, oh my gosh, do I have to create all this? Well, first of all, Rome wasn't built in a day. You can start and then over time realize, it would be really nice if we had a nice welcome video from the CEO. And then maybe that's 3 months down the road and we add that in. And then all of a sudden from that point forward, that's now available to everybody. So it doesn't have to always be right up front everything. It can evolve as we learn and we hear feedback from each move that we complete.
So one of the things, going back to your prior experience with the college recruiting and getting those folks jobs and move to Chicago and other places, but are there any connections that you would see with the college experience and those people graduating and going off to start life with healthcare, and then specific to physicians that might have evolved or changed, or challenges that you see kind of throughout recruitment and what I call a lot of workforce management? We just don't have enough people being born to replace the people who are retiring and dying. And so what are some of the challenges that you see for recruiters, specifically physician recruiters, in the next 5 to 10 years, maybe based on some of that prior experience you had in the college recruitment space?
My mind's going to a lot of different places. Well, I think first and foremost, unfortunately, the challenges in healthcare and as a recruiter in healthcare, it's only getting more and more difficult. As you're alluding to, the labor market is getting tighter. There's not enough providers coming into the workforce to replace those that are exiting. And it's creating a dynamic where people are stretched. They're being asked to fill a lot of roles, and the market for talent is getting even tighter. So being creative and finding ways to leverage efficiency gains, companies like UrbanBound, but there's many, many other examples of software that can help you further your efforts. So that's one. I think another thing that we saw when we first started this company, because we're really disrupting an industry that has been around for 60, 70 years. The relocation industry isn't this new concept. Companies have been supporting their employees for a long time. They've just been doing it through professional services organizations. And those organizations drilled into the minds of their clients, this is a high touch, it's got to be done through people, it's expensive, but it's because everyone's different, everyone has their unique needs and whatnot. And we see how there's a way for software to really make it a much better experience. And kind of to your point about the people coming into the workforce today, and even those that are in the workforce now for decades, we've all become so used to, got my iPhone sitting right here, we're used to using apps, we're used to accessing the internet, we're used to buying our Christmas gifts on Amazon, and there's this notion that people needed to do everything over the phone. And I think most people, even those that are close to retirement, they want the efficiency also. And so that to me is something, just if people have the notion that they wouldn't want to use software, they're definitely going to want to pick up the phone and talk to someone. Like I said earlier, we provide the support as well, but I think what we see with the way people use it at all different ages, they want the software to be the primary organizing tool for what they're going through here.
I think it doesn't remove the pieces of that human element.
Which is why the best suppliers, the best real estate relationships, that's still going to be a core piece of it, because there obviously is an offline component to this. I mean, even your household goods, you have to physically move those atoms from one location to another. Teleportation has not been invented yet. When it happens, that'll be a little easier, but there's an offline component to all of this, but it can be made so much more efficient using technology.
And for recruiters, I'm going back to our days when we were in HR consulting. We used to talk about having a consistent way to actually sell the candidate on the job opportunity. Mm-hmm. And we used to call it the 5 Fs. It was fit, family, fun, fortune, and freedom. Yeah. And in healthcare, what we're seeing with recruitment marketing, there's so many amazing opportunities to sell someone on their lifestyle. In social media, you can see that Jeff Ellman loves skiing, but he lives in Chicago and he's a physician. It's kind of a problem. There's not really good skiing out in the Midwest. But if I'm a hospital system, Vail Health, I'm in Vail, we notice you love skiing. Why don't you enjoy skiing for 7 months of the year and come out here and practice your profession? Like, You can do that nowadays. When we were recruiting in 1999, 2000, we couldn't do that. It was a lot harder to find people's hobbies and match them with job. Now it's just, I'm amazed at how quickly recruitment marketing and social outreach has changed.
Yeah, I agree. I think some of the new pieces we're looking at for next year and really to support clients in those endeavors really revolves around those marketing strategies, because there is a lot of their workforce journey or their life journey that you can pick up on nowadays that we weren't tuned into before.
And it lets you be a lot more surgical in terms of how you communicate with somebody, because it's a lot more personal when you're touching on those personal lifestyle elements that you can pick up online now.
So how do you foresee healthcare recruitment evolving in the next decade? And then what skills will be the most critical for recruiters to succeed? We touched on a few things, but what else would you add?
It's going to keep getting more challenging before it maybe starts to get a little bit better, hopefully, at some point. I mean, I think they continue to say that the deficit for physicians, the deficit for nurses is only accelerating over the next, 6-7 years. So these creative approaches to finding individuals who are a potential fit for the role that you're trying to fill and building a longer relationship with them, realizing that just like anything, frankly, in sales, it's about catching a potential buyer, or in this case, a potential candidate, at the time when they're ready to make a big change in their life and having a relationship that's been built over a long period of time. And I do think that's where software these days can help. There's a lot of tools that let you easily manage those relationships. A lot of the applicant tracking systems have really evolved into candidate relationship management systems. They're not really about the 10 or 20-year-old model of, just posting a job. Back in the day, it might have been on a career builder or a monster.com. Nowadays, more like an indeed.com, and just getting what you can at that moment and then filling the job. It's really about the best in class recruiters are building those relationships over a really long period. So maybe it's 18 months, 24 months after you first made contact that someone goes, you know what? I am actually ready to start talking. And the healthcare systems that are probably ultimately winning that war for talent are the ones that are really good at building those relationships. So I think that's absolutely something that's going to be core over the next 5 to 10 years, is just continuing to drill that sort of skill set and that mentality into the team that's going to be successful.
It's a marathon. It's not a sprint. And I hope that we all outlive this shortage. I'm not sure we will, but the numbers are just staggering when you look across any industry, just the level of people that we need to sustain what we have in society. So
yeah, I think the most recent, I think it was from the AHA, they said it was about 125,000 fewer physicians by 2030 than will be needed in the U.S. healthcare system, which is just, it's scary.
That's why it shocks us that it's taking 9 months to a year to fill so many of these roles. And yet, as soon as they accept, the relocation is just left to chance. I've talked to so many recruiters that I feel bad for, because they fill the job and all of a sudden the family realizes this is way too stressful to actually make this move, and therefore, I'm sorry, I have to change my mind. I'm going to remain in this location, when that could have been prevented by having a great program in place. Whether it's UrbanBound or any other relocation technology out there, there's got to be a better way to support someone during the stressful life transition to a new community.
And I think going back even that onboarding space where you said you guys have found other issues that you're trying to solve, you were afraid you were going to screw that up. And then they would change their mind, or they'd have buyer's remorse. And after their 2-year guarantee was up, they were out. What advice would you give? I know you guys have started participating in a lot of the APPR conferences and some of the regional groups, but we're having a lot of new recruitment professionals coming into the industry, which is great. I think this year saw the most new first-time attendees to the annual conference that we've ever seen. But what advice would you give to those new in this space on navigating the fast-paced and challenges of this field?
Just be patient. There's this ecosystem. We went to the first few conferences, like, oh my gosh, there's so many people. And we were the new kids on the block. And then after a few years of going to these conferences, it's amazing. Everyone looks out for one another. Even though they're competing for talent, they all want to help one another. And that's what we're finding too in our business. It's like, oh, you should know so-and-so with this healthcare system. They need to know about UrbanBound. Like, even though they're competing for talent, they still want that other healthcare organization to have the competitive edge they have by using our software. So it's a really great community where you can make a huge impact and you're desperately needed. And if you do a good job, the sky's the limit for your career in healthcare.
Yeah, I would just say be a sponge. Go out, ask questions, meet people, learn as much as you can, particularly in those first few years, because there's a lot to learn. And I think, as we've been discussing, things are changing rapidly.
Yeah.
And so you'll quickly go from being the novice to maybe being the expert in certain arenas because of how fast things are changing and how technologies are changing, and just the entire dynamic of how you recruit and how you build relationships is evolving. So be open to learning a lot, and I think you'll end up being very successful.
I like the sponge concept. I think that could apply to a lot of things. So do you have any last words or thoughts or things we missed?
The one thing we didn't touch on today is that there are some healthcare systems who still want to give that sign-on bonus, but they want to give additional support. And this is going to come across as salesy, but we did build a platform for lump sum users to stretch their dollars further and negotiate very aggressive discounts for them to book services on their own. And that $10,000 you gave that physician is actually worth $20,000 because they're able to use all the pre-negotiated discounts we have and pass it on to them. So we have so many different products that we've built over the years.
We're built to manage different policies that apply to different jobs or functions in the organization. Really, the question you asked earlier about executive or C-suite or directors, we're built that way because every client we worked in, even before healthcare, that's what they needed. They needed the different policies for different levels in the organization. So it's very, very flexible that way.
On behalf of myself and PracticeLink, I wanted to thank Jeff and Michael for appearing on the Workforce Wisdom podcast today. For our listeners, please feel free to reach out with any thoughts, insights, or questions about anything we covered today. Or if you wish to receive more information about PracticeLink and UrbanBound, please go to our resource center or reach out via email at plmedia@practicelink.com. My name is Christy Bray, and I thank you for listening to Workforce Wisdom.